My name is Justin Beers, and this is my assignment on multi-planar movements. To begin, I'll be starting with the shoulder joint, demonstrating abduction and adduction, which is also in the frontal plane and the sagittal axis. With the dumbbell in each hand, arms straight or with minimal elbow flexion, abduction, adduction, abduction, adduction. Next, we'll move on to the lumbar spine with lateral side bends. We will demonstrate lateral flexion. Again, with the dumbbell in each hand, we'll be going one side to the other. Same with the previous. This action is in the frontal plane and the sagittal axis. Next up, we have protraction and retraction of the shoulder girdle, which is in the sagittal plane and the frontal axis. A good example of this in the gym would be the bench press. At rest, your arms are protracted, retracted, protract, retract. Also in the sagittal plane and the frontal axis, we have knee extensions, knee flexions, knee extension, knee flexion, knee extension. This is often used for leg curls or, for example, kicking a soccer ball. Lastly, we have our hip joint, which is in the transverse plane and the vertical axis. We have lateral rotation, which is when your toes point and your legs turn outward, and medial rotation, when your toes point inward. This is commonly used in stretching with a band, or also in soccer. When receiving a ball, you laterally rotate your foot to the outside to receive it on the inside of your foot, or medially rotate your foot towards the midline of your body to receive the ball on the outside of your foot. Finally, we have our tensegrity model, which tensegrity is a complicated way of saying your body and everything in it are supported by each other and one. The straws and the Q-tips demonstrated in the model represent your bones, and the elastics represent your tissues. So whenever there is an injury or a variation in anywhere in the model, it affects the rest of the model respectively. The model is not straight, I understand, but like all bodies, they are not perfect and have flaws. The best we can do is avoid injury by taking note of our differences in our bodies.